The Center for Cardiovascular Diseases and Sciences was born out of an endowment given by a local attorney, Malcolm Feist, several years ago, and the money was stipulated for cardiovascular research. And since then we've been able to grow cardiovascular research on our campus, and it was already a strength, so we've really grown exponentially. Our goal is to support and nurture cardiovascular research and bring it to really top level, nationally and internationally recognized type of research here. The Center for Cardiovascular Diseases and Sciences provides money for certain pieces of equipment that will help our faculty perform cutting-edge research, and we really have extraordinarily well-equipped core labs at our facility. And we also provide some technical help, and we provide grants that help faculty test out new ideas. So cardiovascular disease is the #1 killer, not only in the US but worldwide. And although we've come a long way in being able to develop devices and drugs that will help with a lot of these diseases, we still have a long way to go. And so from a research standpoint, that's where it starts. So our faculty have grown over the last few years. We're now nearly 60 in strength that perform cardiovascular research, but it's all in different areas. So we have a group of faculty who study stroke, and that is when blood flow gets disrupted to the brain. We also have faculty that study a number of different heart diseases, and kind of feeding into that, faculty that work on the vascular side of things. And this is when blood vessels get blocked and cause some of these serious complications like a heart attack or a stroke. And then we have another set of faculty who are really into the cardiometabolic side of things, and they'll study the metabolic consequences of some of the different diseases that are associated with cardiovascular risk, and that's diabetes, obesity, high blood pressure, high cholesterol. We do some translational research where we'll have a collaboration that we bring ideas from the bench in the lab to the clinical bedside, and the clinicians will also run clinical trials. Each year our clinical side of the Center for Cardiovascular Diseases and Sciences also hosts the Architects Cardiology Conference, and that is to educate not just the physicians here but in our local community about the latest in cardiology and cardiovascular treatment. We have mentoring programs. We go all the way from high school to faculty. We bring in high school students for STEM days to teach them a little bit about cardiovascular disease and the different types of careers here on campus that will support cardiovascular disease. For undergraduates, we have the CURIOUS program. That is the Cardiovascular Undergraduate Research Initiative for underrepresented students. And for those students, they come in for 8 weeks over a summer. We provide housing, and they do a lot of research in that 8 weeks, all in cardiovascular research labs. We have a T32 grant that provides support for graduate students. So these are students doing their PhDs in cardiovascular disease. The last step that we have is a COBRA grant for the Center for Redox Biology and Cardiovascular Disease, and that supports mentoring and funding for junior faculty as they get a foothold on developing their own lab, their own research programs, and so that they can become really successful in the area of cardiovascular disease.